Inserting an nasogastric NG tube. First is to verify the medical order for insertion of an NG tube. Perform hand hygiene and put on PPE if indicated. Identify the patient. Explain the procedure to the patient and provide a rationale as to why the tube is needed. Discuss the associated discomforts that may be experienced and possible interventions that may allay discomfort. Answers any questions as needed. Gather equipment including selection of the appropriate NG tube. Close the patient's bedside curtain or door. Raise bed to the comfortable working position, usually elbow height of a caregiver. Assist the patient to a high Fowler's position or elevate the head of the bed 45 degrees if the patient is unable to maintain upright position. Drape the chest with bath towel or disposable pad. Have emesis basin and tissue handy. Measure the distance to insert tube by placing tip of the tube at the patient's nostril and extending the tip of earlobe and then to tip of xiphoid process. Mark tube with an indelible marker. Put on gloves. Lubricate tip of tube at least 2 to 4 inches with water-soluble lubricant. Apply topical anesthetic to nostril and orthopharynx as appropriate. After selecting the appropriate nostril, ask the patient to slightly flex head back against the pillow. Gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. Patient may gag when tube reaches pharynx. Provide tissue for tearing or watering of eyes. Offer comfort and reassurance to the patient. When the pharynx is reached, instruct the patient to touch his chin to chest. Encourage patient to sip water through the straw or swallow even if no fluids are permitted. Advance tube in downward and backward direction when patient swallows. Stop when patient breathes. If gagging and coughing persist, stop advancing the tube and check placement of tube with a tongue blade. And check flashlight. If the tube is curled, straighten the tube and attempt to advance again. Keep advancing tube until pen marking is reached. Do not use force. Rotate tube if it meets resistance. If the patients are showing signs of distress such as gasping, coughing, cyanosis, and inability to speak or hum, discontinue procedure and remove tube. Secure the tube loosely to the nose and cheek until it is determined that the tube is in the patient's stomach. Attach syringe to the end of the tube and aspirate a small amount of stomach contents. Measure the pH of aspirated fluid using pH paper or a meter. Place a drop of gastric secretion onto the pH paper or place a small amount of plastic cup and dip the pH paper into it. Within 30 seconds, compare the color on the paper with the chart supplied by the manufacturer. Visualize aspirated contents, checking for color and consistency. Obtain X-ray of placement of tube based on the facility policy, as ordered by the physician. Apply skin barrier to the tip and end of the nose and allow to dry. Remove globs and secure tube with a commercially prepared device or tape to patient's nose. To secure with tape, cut a 4-piece of tape and slip bottom 2 or use packaged nose tape for any tubes. Place and slit and over bridge of the patient's nose. Wrap slit ends under tubing and up and over on nose. Be careful not to pull tube too tightly against the nose. Put on gloves. Clamp tube and remove the syringe. Cap the tube or attach tube to suction according to the medical order. Measure length of exposed tube, reinforce marking on tube at nostrils with indelible ink. Ask the patient to turn on head on the side with the opposite nostrils to the tube is inserted. Secure tube to the patient's gown by using rubber band or tape and safety pins. For additional support, tube can be taped onto the patient's cheek using a piece of tape. If the double lumen tube is used, secure vent above stomach. Attach at shoulder level. Assist or provide oral hygiene at 2 to 4 hours interval. Lubricate the lips generously and clean nares and lubricate as needed. Offer analgesic throat lozenges and anesthetic spray for throat irritation if needed. Remove equipment and return patient to a comfortable position. Remove gloves, raise side rails, and lower bed. Remove additional PPE if used and perform hand hygiene.